Hey everyone, it's Dr. Andrew Orr here. I'm coming on today to talk about fertility and some of the stories that I hear, and I'm going to explain it from a point of view that when people often start going on with their stories, I often have to say, I need to just stop you there because I can already see where you're going wrong. Or, they ask me, what is the cause of, what do you think my cause of my miscarriage or my fertility issues? And I often use the term, well, how long is a piece of string? Now, often what I've just been talking to a group of practitioners about this subject as well, because I often on a daily basis, I get case studies sent to me from practitioners. And I get emails as well from women as well, and it's always about the woman. And to give you an example, I had someone, sent me in an email, and it was talking about that they'd had children before and they'd conceived really quickly before, and now they've been taking a long time to fall pregnant again, which is quite common. We often see that people can fall pregnant quite quickly, and then the first time, and then they struggle the next time. And then what actually happens is, because they've conceived before, they're presumed that they're fertile and there's nothing wrong because they conceived, and then all these things get overlooked. And then sometimes we see, they will conceive the third one, and then they'll end up in a miscarriage around, 8 to 12 weeks. And then they'll take a long time, like I'm saying with this one here. I've got this one here, and it's saying now that they're up to their, seventh, eighth time or cycle, and it's getting up to nearly another year of trying again and still nothing. And then they'll often go into the women, or the practitioner will go in. The woman says that their menstrual cycle, blah, blah, or this, the women that, talk to me go, well, my menstrual cycle's this, and now I'm getting spotting, and I've got clots, and I'm starting to get pain now, or I've got abnormal, bleeding in between cycles. But whether it's a practitioner or patient, then they say, I've gone and had all my blood tests done and they've all come back fine. And then the blood say that I'm ovulating and all these other things. And then they say, and I know when I ovulate, and I'm making my partner come and have sex with me at this time, and we're trying during that period and stuff like that. And often when I hear that, it raises a couple of alarm bells. One, when a practitioner just brings in the female perspective, it raises a really big alarm bell, because as I've talked about, a lot of practitioners don't know how to treat fertility properly. And then a lot of people from the public, when you're caught up in this thing, it's very hard. You get very tunnel vision. And it's like, I've got to fix me, I've got to fix me. And you can see that because a lot of the females are the driving force behind the fertility stuff. There's varying reasons for that. Sometimes women want to have another baby and their partner doesn't, so they don't want them to know that they're trying again. So there is that. And then we have the whole thing where you've got non-compliant males as well. But as I always say, that fertility 101 requires a male and a female. It requires a sperm and an egg. That's for a heterosexual couple. I've talked about, I see same-sex couples too. But even when I see same-sex couples, I still see the couple. So it's actually unethical, and there's legal implications if you don't investigate both people, especially, let's just talk a heterosexual relationship for now. You have to treat and investigate both the male and female. It's actually unethical and illegal not to, and it's part of good ethical health practice. And I tell people, when they come to see me, I have to see the couple, and I won't take you on, because if we just saw the female, you're not doing fertility work. You're only seeing one half of the equation. It's just doing hormonal regulation. It means nothing. If a partner's, a lot of the time, the males are the issue. So as I was saying, what I'm trying to get to, and why I often pull people up and say, hey, hang on there, before you go any further, you're not looking at one thing. And I'll say that to practitioners as well. Hey, you better pull up there. I can already see where the issue is. All I can see is stuff about the female. Where's the male? Because you know, again, 50% of fertility issues are related to males, and up to 85% of miscarriage issues can be related to chromosomal factors and DNA factors with poor quality sperm. And a lot of people, oh yeah, but he's been checked. I've never, honestly, I've never seen a guy that's come in when couples are having issues. There'll always be a factor of both male and female. There'll always be a bit of both. And 9 times out of 10, the male isn't good at all. And what we have to remember is that sometimes when they're getting these semen, now a semen analysis is just a baseline test. It's not, it doesn't look in like we have other tests, genetic tests and things like that, that look at the DNA of the sperm and things like that as well, which are far more important than just a semen analysis. And then we've got genetic stuff. And I've talked about this in other posts. And talk about how long's a piece of string, and the genetic factors in fertility are huge, because it's no use like when people ring up and or trying to see and they want, you know, vitamins and lotion potions and all kinds of things. There's no magic pill, because if you've got a genetic issue, you can throw as many lotions, potions, magic pills, whatever you want to call them, at people. It's not going to help a genetic chromosomal issue. And a lot of these things are overlooked. So we see often when people have had previous children, then they're having miscarriage and they're not conceiving, they get overlooked and they think, well, they've conceived before, so there can't be anything wrong. Never presume anything with fertility. Never, ever, ever. And this is why when someone comes to see me, you've got to look at everything. I never presume one thing. They could have 5 kids. Those 5 kids might be miracle kids and just a fluke. And we see that with couples, or I've seen couples that have conceived the first time very, very quickly and then haven't been able to conceive. We've gone and investigated the female, she's got blocked tubes, so she wasn't going to conceive. So in between the first one and the second one, the tubes have been probably already partially blocked and then blocked completely. And then we look at the male, and the male's not good either. So there'll always be a bit of both. And just remember with IVF and procedures that when we've got ICSI, which is basically injecting the sperm into the egg, we only need 1 single sperm now for 1 single egg. So what is good for IVF is not good for natural conception. I need people to understand that. And we also know that a lot of people, a lot of healthcare practitioners, that's medical and in the complementary medicine area, they haven't got any postgraduate training in fertility or reproductive medicine, and they often don't know how to interpret these things. So even general practitioners, I say, look, they're general practitioners, they're not specialists. They have to know a bit of everything. So when you need fertility, you've got to go and see a fertility specialist. But your GPs, it's not putting as I always say, I'm not here to put, you've got to have a good GP, but you know what I mean? Then they're a general practitioner, and we see a lot of people in complementary medicine, they're just general practitioners. So they're trying to do a bit of everything. So you've got to see someone who truly specializes or an expert in fertility. So this is what I'm trying to get through to people, that you can't just see the female. You have to see both sides. And for fertility 101, it takes a sperm and an egg, a male and a female. And that's really what often gets overlooked. And I've talked about this before with a lot of the dysregulation and the fertility profession not being properly regulated. There's now been a lot of media coverage of this too. So I wanted to sort of get people to understand, especially because a lot of people that contact me are females and they give me their story, or I get a practitioner that's just giving me the female story. You can't just have the female story. You've got to have the male story as well. So you've got to fully investigate the female and you've got to fully investigate the male. We're talking heterosexual fertility at the moment. Forget we do have same-sex couples as well who we see that it's a different story. But let's just, like I said, just for the sake of this one, it has to be you've got to see both sides. So even if they were a same-sex couple, I would still look at them genetically. I've talked about that before, because maybe one that thought that they were going to become the, the mother, or they were going to become the donor, might not be able to. We've got to look at both sides. So even with that, or, sometimes with single females, we have to change up sperm for them. Then we've got to evaluate them and make sure they're looked at completely 100%, but then look at their sperm might not be, the donor sperm might not be great either. Certain countries don't have certain screenings and so forth. So it depends where you get your donor sperm, donor eggs, and all donor material from. So I hope that explains a little bit fertility is not as cut and easy. And just because you've conceived before doesn't mean that you don't have an issue now. A lot of issues can be overlooked from the very first time. A lot of genetic issues get overlooked. Just because someone says your sperm's okay doesn't mean it's okay. And I always tell people that when I do semen analysis, I want results. I want blood tests that are less than 3 months old. Really, even something that's a month old as a blood test is still too old. It's not nearly obsolete. But a semen analysis, at least, it has to be within. I always get a new one done, so it's current. Because every time a male ejaculates, it's different sperm. Every time a woman ovulates, it's a different egg. You don't just have the same sperm and same egg all the time. They're not all the same. Sperm levels change by, up to about 20% each time you ejaculate. And who knows what people have been exposed to in that 3 months. 3 months is a long time. And the life cycle of the sperm is around about 90 days. So what you've done 90 days ago will show up in your sperm today. So you've got to take into all those considerations. So this is why it's so important that when you do proper evaluations, you look at all the medical testing, you look at your bloods, you look at the surgical evaluation, you look at the mental aspect, you look at their diet, their lifestyle, their weight, you look at their exposures, their stress levels, their everything. This is why preconception care and planning and investigations is so important, and why I always say I've got a no stone left unturned approach. Never presume, never presume. Even if you've had children before, never presume that you don't have an issue, and never take anyone's word for it, because somebody you might have seen may have just missed something. So this is why I say to people, a second opinion or a third opinion or even 10th opinion is really important. As much as it's a pain in the behind, it could save you and be the reason why that you're not having success, or be the reason you do have success. And see a true specialist or a true expert, that's someone that's all they do is really focus on fertility, not do a bit of this or that and that and that and that. No, go and see a true fertility specialist or a fertility expert, and someone who's got the proper training, which I've talked about in a previous post of mine, and make sure they've got the proper postgraduate training in reproductive medicine. I hope that helps a little bit. I just wanted people to understand that, it's sometimes we have to, and why we have to explain that you have to see the male and female, and we can't just be blinkered and look at the female. And I know how people get there, and it's, it's frustrating and it's tiring, and you've had a couple of miscarriages, and I can't begin to understand in my own mind is how devastating that is for people. And it's terrible. There's a lot of emotions and all that. But that's where you need someone to be able to help you on that front, get you the help you need, which is what I do. And I get counselors and we talk about it and we go through all this stuff. And it's listening to people's concerns and listening to people's stories and that, and then go, okay, now what do we need to do? Yes, it's really sad and everything's what happened, but we need to focus now. We need to go, right, this is what you need, this is what you need, this is what you need, this is what you need. And we need to look at both of you. All right, I'll talk to you soon.